Now starting, all attendees are in listen-only mode.
Good evening, good day, hello, good morning. Whatever time of day it is where you are, we're really glad that you are here with us to watch our Coaching Clinic Series introduction. This is our welcome to the Coaching Clinic Series for all of the coaching clinics that you will watch as part of your regular week-to-week study as you move through the program. These webinars are supplemental to your study, but they are a requirement of the study as well because they are integral to helping you be successful on the NCLEX. So let's talk a little bit about these webinars. Why webinars and why coaching clinics? What's the big deal with these? Well, first, they are study support. These webinars and coaching clinics are going to give you tools and strategies for effective study and effective analysis of the questions that you will have to answer as part of your preparation for the NCLEX exam. In addition, they will reinforce your key concepts and skills that you'll use throughout the program, and they will result in an improved NCLEX outcome. We hear regularly, routinely from nurses who pass the NCLEX that one of the key factors to their success, in their opinion, is the fact that they attended webinars. And when we look at those who are not successful the first time through, one of the key things that stands out is lack of webinar attendance. So we are certain that this is an effective and helpful part of the program, and it is why it is so key to success in moving through this program. So how are you going to use these webinars effectively? Well, first, you want to watch them in the assigned weeks. These webinars are paired with your study to be able to give you a good flow and good practice with your questions as you answer them and to support the study that you're doing from week to week. And then you want to watch them again as you move through the program for reinforcement, because these are only a handful of webinars in reality. There's only about 10 of them, and you'll be able to review them over and over throughout the program as you move through it. We expect you to be in our program for about 25 weeks. That means you should get through this set of webinars at least twice as you move through the program, and you may go back and watch some of them a third time depending on where your specific needs for reinforcement are. And then you're going to apply the concepts to practice questions to improve your analysis and test performance. Attending your live content and question clinic webinars weekly will also provide further support and practice with answering questions successfully. All of these webinars together, the recorded coaching clinic series plus the live content and question clinic series, will be key elements to your success on the NCLEX. So let's talk about the NCLEX for a minute. This little picture here is the Bloom's taxonomy. It is a cognitive evaluation and breakdown of the processes that we go through when we're learning information. So the foundation is remembering. This is similar to when we learn the anatomy and physiology of the heart, for example. So I know the atria, the ventricles, the valves, the pulmonary vessels, right? I know all of those pieces of the heart and that coronary circulation. Understanding would be the additional level of being able to describe the flow of the blood through the heart and the purpose of that flow, knowing that the flow from the body to the heart comes from the vena cava into the right atria, that's then pushed into the right ventricle, that then goes through the pulmonary artery to the lungs, from the lungs through the pulmonary veins back into the left atria to the left ventricle, which then pumps it through the aorta out to the rest of the body. Understanding the blood flow and the function of each of the elements of the anatomy of the heart is that understanding level. Applying would be when I understand now how the blood flows and how the heart works, that if a heart is starting to fail, then what could possibly happen in that person's body as a result? And then analyzing moves on to go, what can I do to help mitigate the impact of that failure of the heart? And then, of course, evaluating is, now that I've done these things to mitigate those effects, are they effective? How am I how is my patient doing? And then creating would be, okay, based on that evaluation, what's the next thing that I think I should do for this patient? So moving through this Bloom's taxonomy, you can see how the cognitive effort, the cognitive ability is significantly more complex as you move up the profile, right? Up the triangle here. So this is an exam that's like no other nursing exam in the world, because most exams don't function at the same level as the NCLEX. The NCLEX tests your application and analysis and higher. So its passing standard is going to be at the applying and analysis level of the Bloom's taxonomy, whereas the rest of the world's exams typically test at the remembering and understanding level of Bloom's taxonomy. So it's a totally different exam, right? It's much more complex. So that means you need some strategies and some tools to help you be more successful in answering these questions. And that's why we teach you these 6 steps to question success. The first step being to identify exactly what you're being asked, and then what kind of question am I being asked? The second step being to identifying the topic as it relates to that instruction that you're given from step 1. And then using your keywords and clues in your question to help pull out and focus the information that you need about that topic. And as you're doing that, then step 4 is to apply that knowledge and what you know about that topic and the expected outcome of the question that you're being asked. Then you're going to review each answer choice and eliminate anything that you can identify as immediately being wrong, because you know something about that answer choice is incorrect. Either it doesn't answer my question, or it's false information, or it's not relevant to the scenario that's being presented. Okay? And then you're going to apply specific strategies based on the kind of question it is. And after you've done that, you'll then reread your question to determine if your selected answer choice actually answers the question successfully. So working through these steps with each question is going to feel at first very awkward until you get the hang of it. Know that it's going to slow you down a little bit, but that's okay. It takes practice to get good at it. The whole point is to practice so that you do get good at it, because this will be a key element to being able to effectively analyze your questions. Then you're going to use the strategies that you'll be taught through these coaching clinic series. This is going to involve using your critical thinking and applying these strategies and deciding, okay, this is a delegation question. Am I delegating to another RN? Am I delegating to an LPN? Am I delegating to a CNA? And do I remember what's the scope of practice for these people and what's going on with this patient? Is it an appropriate patient to be delegated to someone else? Or is this a question that's asking me to prioritize? So I'm going to look at airway, breathing, and circulation first, and then I'm going to look at physiological needs, then safety needs, then psychosocial needs, then assessments, and then planning and interventions and evaluation. Right? I'm going to work through this prioritization process until I get to the space where I get the answer to my question, because it's asking me what's the most important thing that I need to do, or the thing that I should do first. Then there's other questions that are going to be focused on how I'm communicating with a patient. Am I helping to support them in their decision making and in their exercising their rights as clients? Am I helping them to work through their own thoughts and feelings about their situation? Am I supporting their decisions? Am I minimizing their answers or their questions or their feelings because that's not therapeutic? Right? Evaluating my answer choices to see how am I doing? Am I giving them knowledge that they need, or am I giving them advice that they don't need? And then the next kind of question we run into are the questions that require some sort of a decision tree. So some questions you'll realize your answer choices, that one of those choices is a big broad choice, whereas the others are more focused and narrow and actually fit under that umbrella of that big broad choice. Other times your questions will have answer choices where you'll realize that several of those choices are very similar to each other, but one of them is significantly different. It goes in a different direction, or it focuses on a different element. And frequently that orange is going to be the correct answer in that basket of apples. Other questions will have fixed versus flexible language. And fixed language tends to be incorrect because it doesn't leave you any room for adjustment based on your patient's response, whereas flexible language does give you that room. And then other times you're going to be looking at your question and just saying, none of these others really apply because the answer choices aren't looking at that. What I'm trying to figure out here is whether I'm supposed to be focused on an assessment or an intervention. Or am I focusing on a psychosocial versus a safety or a physiological need? Or am I looking at an ABC issue? Because it's essentially the opposite of prioritization. They haven't asked me what's the most important thing or the thing to do next. They're asking me in a different way. And so I'm working kind of backwards in that process to follow this decision tree about what I need to do next. And so working through all of these different strategies, depending on the kind of question you're being asked, is going to be one of the key factors in helping you successfully apply your steps so that you can successfully analyze and answer the question. All of these things are important, and these coaching clinics in this series are going to help you master the steps and the strategies to be effective in evaluating your questions. So we want you to remember that we're all about your success. All of the webinars are built to help you master content and conquer questions. The more you review and implement the recorded webinars, the better the information sticks with you and the more your skills improve. The live webinars that you attend and interact with the better you will be at answering those questions successfully and higher your scores will be. The webinars plus content review will be key to your successful knowledge accumulation and implementation of the steps and the strategies for effective question analysis. You can do it, and we are here to help. Thank you for listening to our introductory video here, and go on with your next coaching clinic webinar as scheduled based on what you've been sent in the clinical schedule as your introduction to the new program. We welcome you to the Avant NCLEX review, and we look forward to your success on the exam in just a few short months.